Other news today, Michigan is slipping when it comes to the well-being of our children. Let's talk about those numbers. The latest Kids Count survey shows the state now ranks 30th in the country. That's 3 points worse than last year. The report shows unemployment is hitting families the hardest, with 31% of children having at least one unemployed parent in 2008. The national average is 27%. Michigan also comes up short in low birth weight babies, but it is showing improvement in child death rates, teen birth rates, and the rates of high school dropouts. So those are some encouraging signs in the report. Dr. Dan McGee joining us. He's a pediatrician with the Helen DeVos Children's Hospital. Thanks for joining us once again. We appreciate that. The economy really seems to be having an impact on these numbers. Now, we were talking just a few minutes ago that these are some older numbers, but the economy really hasn't improved much, has it?
No, and I think part of it is you have to take the good with the bad. You mentioned that there are some indicators that are up, there are some that are down. In fact, in 5 of the indicators, Michigan was actually up, and 3 of them they were down. I'm encouraged by the fact that there are less teen births than there were before. The infant deaths are down, but I think a lot of it still has to do with access to health care. And that, again, is directly related to the economy, that if people had more access to health care, then they're going to get better prenatal care, better counseling, and avoid some of these things that these indicators show.
It really comes down to access to health care then with you. That's what you're saying. What can we do you think, as a community that you'd like to see as a doctor that can show some improvement to turn these numbers around that are on the lower side and maybe improve the ones that have even shown some growth?
Well, obviously in any kind of election season, it's, you can be tuning your own horn or anything, but I think what we need to do is just be able to open our doors, provide good reimbursement, and just make more people eligible for the kind of health care that's out there for the rest of the population.
So what about in your practice? Now, you're a pediatrician. Are you seeing any changes based on some of the reflection, say, of these numbers?
Well, I think anytime you have a downturn in the economy, you find people not going in early, and they wait and postpone care until later. And so very often you see children that are sicker when they need to see the doctor, and then you have to actually spend more money on health care than you would if you were able to get to the problem early.
Some of the trends we're seeing, so hopefully we can turn those numbers around. Dr. Dan McGee, thank you for joining us. We appreciate your thoughts.
And thanks for having me.